before. My name is Carl. I am also a former employee of the California Indian Manpower Consortium. I worked there for about 5 years. I've been in healthcare about 2, so I'm currently working at the Sacramento Native American Health Center as their executive assistant. I'm also a consultant for the Working Skills into Careers project and am a Hoopa Valley tribal member. So I'm not by any means an expert in healthcare, but I am fortunate enough to have wrangled in an expert, and I'd like to introduce Britta Guerrero, who is our Chief Executive Officer here at the Native American Health Center. She also sits on the California Primary Care Association Board. And Carlos Apache. Britta, can you say hi?
Everyone, thank you for having me.
So just before we get started, I just want to do a quick word about the presentation that I put together. The majority of this information is all available on the internet. A lot of it is from the California EDD office and the United States Department of Labor. In any time and want more information, all of it is readily available at your fingertips. The presentation is just a brief overview of the medical assisting profession. As I go through the presentation, I'll be asking Britta to maybe jump in and expand on a few of the points as we go along. In this presentation, we'll discuss what a medical assistant is, what basic characteristics medical assistants have. We'll discuss the employment outlook for medical assistants, which will include pay range. We'll follow it up with a quick discussion of training programs, certification, and where to look for jobs. With that, let's begin and talk about what a medical assistant really is. A medical assistant is an allied health professional that supports the work of physicians, mid-level clinicians, and other health professionals in a hospital, clinic, or specialty environment. Can you maybe provide us with a few examples of what specialty environments might be?
Sure. So at Community Health Center, one of our main allied sources for healthcare are specialty providers, specialty centers, specialty physicians' offices, so cardiology, endocrinology, dermatology, and then there's outpatient surgery centers and outpatient treatment centers for a majority, or for a majority of specialties that you would see in the hospital, but in individual and small physicians' offices.
So let's take a look at what some of the general duties medical assistants might perform on a daily basis. Medical assistants are cross-trained to perform both front office and back office duties. Can record patient histories, observe vital signs such as blood pressure, assist physicians with patient examinations, can schedule patient appointments, prepare blood samples for laboratory tests, enter patient information into medical records, referrals, and fill out forms, assisting with minor procedures, and they perform other routine clinical tasks. It is important to note that medical assisting should not be confused with physician assistants who examine, diagnose, and treat patients under a physician's supervision. Tasks that you might think of, Britta?
What's important about the characteristics of a medical assistant is that you're the first point of contact in the exam room with the patient. And so you're actually building a rapport with patients, and you're creating a relationship between yourself, the patient, and provider. And so you're doing the initial intake, which can include anything from very personal questions like history of substance abuse, domestic violence, homelessness, things along those, any of the risk factors or stress indicators for any patient, and making sure that that's recorded properly and that the physician knows what some of the barriers may be to completing care. And you really are the person who coordinates resources for each patient. So really being empathetic and being able to be that conduit between the provider and external community resources is really important.
So I'm really glad you said all that, because you just lead it into my next slide. So let's discuss a few of the traits that we might expect of medical assistants. Medical assistants are frequently caregivers, they're parents and helpers in our communities. They have strong communication skills. They're empathetic, meaning they have the ability to understand and share the feelings of another person. They tolerate stress, have the ability to endure difficult conditions or situations, have self-control and are courteous, display integrity, meaning being honest and having strong moral principles or are upright, show great attention to detail and are agile. They have the ability to be quick and graceful. Mental agility might allow a person to follow both conversations at once, so they could be great multitaskers, and they change. So basically, people in medical assisting field are going to want to be people that enjoy helping others.
So we do it. Oh, sorry.
Go ahead, Britta.
So the way we do it at the health center is that we have medical assistants assigned to a specific provider, and they're part of a care team. So they have the support of a nurse if they need it for triage or higher level of patient care, but they have to have the ability to anticipate what the physician is going to need. They learn what the physician likes, what the physician doesn't like, how to set up a room, a tray, or prepare for that patient visit. And just like no two patients are ever the same, no two visits are ever the same, and no two exams are routine. So it's really exciting, actually, because you get to learn a lot, you get to be part of a patient's care, and it's ever-changing. So you really have to like variety in your work.
Awesome. So with that, let's take a look at the employment outlook. So this information came from the United States Department of Labor. They have some great career guides up on their website. And according to the USDOL, employment of medical assistants is projected to grow 23% from 2014 to 2024. It's the fastest growing national average for all occupations. And attribute this to the aging baby boomer population, meaning there's going to be a larger aging population in care, the increased access to health care, and, of course, Obamacare, also known as Affordable Care Act. Can you talk a little about the expansion of health care and what it might mean for those seeking to enter the workforce as healthcare professionals?
Sure. So every state has decided to participate in what we now know as Obamacare or the Affordable Care Act. But in California, one of the things that we've done is that we've decided to take additional government subsidies to expand accessibility and eligibility to Medi-Cal. So what used to be that people who were at 100% of federal poverty used to be eligible for Medi-Cal, and that's an income guideline. In the state of California, Medi-Cal eligibility is really determined by not only being 100% of the federal poverty guideline, which means you're eligible for TANF or family aid. You can have a job making minimum wage and be up to 138% of federal poverty level, which actually means you have a significant wage. You're not a minimum wage earner. You may have a dependent child, or you may not, which is the first time an individual without dependent children could be eligible for Medi-Cal. Basically what that means is in Sacramento, because that's where we're located, I'm going to use us as an example, that the population of Sacramento has an additional 250,000 individuals who this year are eligible for Medi-Cal for the first time, which means that more patients have access to health care. There are more health care jobs available to individuals than ever, and actually this is a very competitive environment. So you can actually pick and choose where you'd like to work, and the salaries are pretty competitive. So you actually have large hospitals and large hospital systems like Sutter and UC Davis, or small clinics like our health center, which is the Sacramento Native American Health Center, or individual physicians' offices to choose from and are actually competing over the most qualified applicants.
Thanks, Britta. So with that, let's talk about wages. How much medical assistants are expected to make? In the California EDD office, the median wage in 2015 for medical assistants was around $34,089 annually, computes to $16.39 hourly. So according to their figures, it ranges from the low percentiles from 27 and can go as high as 41,000. Training are different programs available for medical assisting. So what I've done is, rather than list all of the available programs in the area and throughout the state, I've provided the links to the Commission on Accreditation for Allied Health Education Programs and the Accrediting Bureau of Health Education Schools. We're accrediting bodies for health education schools. Each of the accrediting bodies has a directory of schools and programs which are accredited and make it really easy to find programs for medical assisting in the area that you're seeking training. Can you maybe provide some insight as to why accreditation is so important?
Sure. Well, you definitely want to go to an accredited school so that when you're out applying for jobs, your employer is considering your certificate of completion from an accredited school. If it's one of these that's not accredited, the job offers that you're going to get, basically curriculum is not what the standard is nationally. And in the state of California, the standard is a little bit higher than in most states. Something to really consider about attending an accredited school or training center is that there are opportunities for you to increase your knowledge and continue your education. And if you start as a medical assistant, you could very easily, in the 9 months, move into an LVN or an LPN, which is a licensed vocational nurse or a licensed or advanced practice nurse. Those positions can continue to grow and not only factor in your accredited education, but also your years of experience. So it's a real opportunity to continue your education and also increase your income and your knowledge for years to come. There's really no limit on where you can go once you get your foot in the door with medical assisting.
Excellent. So medical assisting would be a great gateway to enter the healthcare industry, which could lead to other positions, correct?
Absolutely.
Awesome. So next I'm going to take a quick look at an accredited medical assisting program here in the Sacramento area, which is also listed in one of these directories. Look at that. The Cambridge River College is a community college here in Sacramento. They have an associate in science degree in medical assisting. So assuming a candidate has obtained their high school diploma or GED and has no other education, this medical assisting program might take about 2 years to complete in the community college system. So the required program at Cosumnes River College, as you can see right here, is only going to be about 25 units in addition to your general education and elective units. Note that the college is accredited by the Commission on the Accreditation of Allied Health Programs, which is eligible, graduates will be eligible to sit for the National CMA credential. In addition, for CRC's medical assisting program varies based on the current cost per unit, in which that usually depends on the state's budget. Currently, the cost per unit at CRC is $46, and we're assuming that the total amount of units required for this degree is 60 units, which got about $2,760 total for tuition, and that does exclude your books and supplies. So the reason that I like the community college example is largely due to the cost of tuition. I know there's like a lot of vocational training schools out there that offer the program, and they have accelerated programs which promise quick turnaround time for degree and graduation, but they can cost in the tens of thousands of dollars. Shop around and evaluate the costs of all options. You could be paying on it for years to come, so you should know when you're looking for a program to know exactly what you're signing up for. I want to note that the Board of Governors fee waiver is available specifically for students at community colleges, which will waive your per unit enrollment fee if eligible, and links provided at the bottom.
Our plug for working in a community health center or a tribal health center or tribal organization is there are several grants available to help pay for your education and loan repayment opportunities from OSHPD, which is the Office of Safety and Health-Wide Planning Department of the state of California. And they will actually repay your student loans, and they will also give you incentives for completion, especially with the healthcare shortage in Sacramento. There's been more federal money actually given to these opportunities. And so definitely for Native American students and for non-natives as well. So there are a lot of opportunities to get those loans paid and also to get grants to attend medical assisting school.
Can you just repeat where prospective candidates might find information regarding those loans and repayment programs?
So you could actually take a look at the Indian Health Services website, and that's the LRC, the loan, or LRP, excuse me, the Loan Repayment Program. And then OSHPD is the State of California's Office of Safety and Health Department. OSHPD is the acronym, and they've got grants and scholarships to help with entry into health careers, and also the National Health Service Corps. And if you work in a low-income community or a predominantly Medi-Cal or Medicare environment, there are additional opportunities to get repayment for up to 5 years, depending on how far and how much you want to further your education. So NHSC, which is the National Health Service Corps, OSHPD, which is the Office of Safety and Health Development, and Indian Health Services, it's the LRP, the Loan Repayment Program.
Great, thank you. Great, so upon graduating, say a prospective candidate goes through the program and ready for graduation and entering the workforce, MAs will want to become certified. Being certified is certainly not a requirement. It does come highly recommended. Most employers these days are likely to hire certified medical assistants and will typically offer higher pay to job candidates that have been certified. Research I've come up with 2 certifying boards that offer the credential. Can you talk a little bit about why the credential is so important?
Well, I think when you're looking at becoming a medical assistant, the pay differential is what's most important. It's the difference between an entry-level medical assistant salary and a pay differential of up to $2.50, which can make a difference in your household income. But more importantly, I think understanding that you have additional responsibilities as a certified medical assistant, which can lead to the refilling of prescriptions, assisting with triage, and so you're going to want to do more and you're going to feel proficient pretty quickly when you learn the system in whatever healthcare environment you work in. So taking additional responsibilities will improve your chances at increasing your salary and also increase your responsibilities, which really makes you feel good at your level of capacity to learn and at the responsibility level that you carry in your position. So the more you can do, the more you're going to get paid. The more skills you have, the more valuable of an employee you are. So always looking for those opportunities to further your skill, further your experience, and learn more. It makes you a more valuable employee.
Great. So would you say there's a difference between the two certifying bodies? What's the advantages of becoming certified in California as opposed to just nationally?
Nationally is really important because if you travel, for instance, maybe you go in and out of state, you maybe live outside of California in the spring, and then you're traveling to stay with your relatives in the summer or whatever that looks like. You can take that national certificate anywhere. But like I said earlier, California has a higher standard for health care. And if you're certified in California, you are not only receiving the highest standard of care, but you've also been approved by a body that says you've passed the most rigorous test and you have the ability to take on additional responsibilities of what a normal medical assistant could do.
Great. So one slide that I did not include was, so one candidate has completed training, obtained their CMA credential. Where might you begin to look for work? Britta, would you have any suggestions?
Sure. I mean, you're going to have your regular Monster.com, Indeed, your regular places that you would look. But I think what's more important is that you're really looking for an opportunity to further your experience. So if you want to work within the hospital system, there are a number of healthcare jobs on the hospital job board. So Kaiser, Dignity, Sutter, Mercy, you'll see a number of medical assisting jobs. But if you want to work in a community health environment, the California Primary Care Association has a job board. And if you work in a community health environment or a tribal health clinic, the opportunities for loan repayment are significant. So you're really going to want to take that into consideration. If you go through the Primary Care Association, you will have opportunities for loan repayment, educational contribution. You're going to be working with your own community. And what's really important is that you understand the individuals who come in and receive services because you're from that community. So immediately you're starting to form a level of trust with those patients that other individuals can't do. It's just off the bat. So we're always looking for Native applicants. We're looking for highly qualified Native staff. And when we find them, we have a tendency to keep them.
Can you maybe provide a little information regarding our Indian preference and hiring policy here at the Health Center?
Absolutely. So we are a federally qualified health center, and we are an urban Indian health center. So basically, there is a federal law that says when you've got two equally qualified employees, that your Native employee can receive preference. And if you've got a trainable Native applicant who is qualified, you can actually consider them before another equally qualified applicant. So it's a really good opportunity to work with your community and also be considered for additional education contributions and continue to grow in your level of responsibility and your capacity. So it's definitely something to take advantage of if you get the opportunity.
Great information. So on to this next slide, I've just put on the resources that were mentioned throughout this presentation. You locate accredited programs to the different accrediting bodies here. There's the link to the FAFSA, the Board of Governors waiver application for Los Rios Community College. There's the Certifying Board of Medical Assistants and the American Association regarding the CMA credential. There's program information about Consumnes Rivers College's medical assisting program. And then I also put SNAC's website up here for employment opportunities. We are expanding, so there might be opportunities for medical assistants in the future.
There are 13 medical assistant positions available over the next year. So we're definitely looking for Indian applicants, and we definitely need medical assistants, as does the majority of the community in Sacramento.
So with that, that is all that I have. I think I'd like to open it up for questions and answers. Again, Britta is on the line. She's very knowledgeable of the industry. I would hope that people take advantage of that and ask questions about medical assisting or any other healthcare professions that might be on your mind.
Okay, thank you. I'm going to go ahead and open up the lines for everyone that's on the call, so just let you know. If you do want to mute the line and you're logged in, you can click the microphone next to your name, just in case you want to be muted. But lines are now open if anyone has a question, or you can put it in the chat box as well. Also, some of the sources you mentioned I listed as well on the chat box, so if someone misses, I put in those that were mentioned during the webinar up there as well.
Say that.
Okay, perfect. Are there questions out there? Everyone...
Are internships, available for that occupation?
Absolutely. One of the requirements, actually, of becoming a certified medical assistant is that you complete, depending on the program, a 100 to 200-hour externship. And just like we mentioned Indian preference in hiring, we also offer Indian preference in turn and internship opportunities. So we actually are always looking to hire folks that we train in their internships and externships. We get the opportunity to see their work ethic, their rapport with patients, and their ability to carry out tasks assigned by the providers. So always looking to onboard our interns and externs.
Thanks, Britta.
Anyone else? Any other questions out there? All right. Well, it looks like unless anyone has any more last-minute things that you guys all set. All right. I want to thank Carl and Britta so much for being on the call today, taking their time out to come and share with us that information. That was great. I know so many of us will benefit from that information. And again, thank you to everyone on the call for taking your time as well to sit in and learn about some more medical assisting in healthcare. And just a little plug for our next workshop, which will be April 20th, same time, 11 a.m. And if you're interested or you know people are interested in the Career Web Series, you can always contact CIMC and we'll get you the links and get you set up. So thank you again, Carl and Britta. And to everyone, have a great day. And I'll see you again.
Thanks, Carl. Thanks, Britta. That was awesome.
All right, guys.
Information. Thank you.